she asked, she's a nurse in a prenatal care unit, if I understood correctly.
Yes.
I'll probably get all three of these jumbled up. But let me start with I forgot all of it. Let me start with the one on the firearms. Right now, the Democrats are very hesitant to bring up anything that deals with the Second Amendment because they've been so beaten up about it. Talking about that Guantanamo Bay detainees, right now, you refer to them as Gitmo. Gitmo is short for Guantanamo Bay. It's a military acronym. I've been down there twice, by the way. I've also been to Fort Leavenworth, the prison, to see the comparisons. Kansas is not suited well for these military detainees, these military combatants. These guys are hardened terrorists that have sworn to carry out military activities against United States citizens. They view us as the great Satan, and that's their view of Islam, and I think it's a false view, and certainly a destructive view. And I have opposed that. I was the first one in the Kansas delegation to speak out against bringing the detainees to Kansas. I continue that opposition. I've had legislation that would even prevent them from flying them out of Cuba, where Guantanamo Bay is located, to the United States for trial. I also had a bill that said if you get them here and you can't convict them and you turn them on the streets, they can't get welfare benefits. But the administration says they want to give them welfare benefits. It's very upsetting. What can we do as citizens? I think if you go to house.gov on the internet, or you can go to my website, tiahrt.house.gov, G-O-V, you can find any legislator's email address or phone number. You can call and send them an email, and I would advise you do that. And feel free to contact my office as well. I get about 250 contacts a day as an average, and we respond to each and every one of them. But I think it's important that your voice is heard. I know for a fact that when one person calls me and talks to me upset about an issue, they are not alone. There's another 10,000 out somewhere in America or in Kansas that are just as upset. They just haven't had the time to pick up the phone yet, or they don't know where the website is, or they don't know the phone number. So please have your voice heard, even if it's not your member of Congress, even if it's the Speaker of the House. Now, they may tell you that, oh, we're not going to deal with it, but when they get that contact, they know something's going on. And they have a politically attuned ear, so they would be reading something going on there. And I have to tell you, thank you for coming out today, because this is a statement in itself. It's a statement about what's going on in Washington, D.C., about the money we're spending, about this health care bill, and I appreciate you all being here. And the third part of your question was what?
The Green Czar.
The Green Czar, yeah. Who's an avowed communist. Well, again, elections have consequences. This is something that President Obama is very comfortable with, appointing him. I'm not very comfortable with it. If it's up to me, I would defund all of the czars. I don't see them as having a part in any of the laws of our land because they're not designated as a part in any of our land. President feels comfortable with it, and I think we should do something about making sure they don't have at least no money for staff. Yeah, we have separation of powers, and so we do entrust the administration with the executive branch with the administration of our government. I'm in the legislative branch. We're supposed to do the laws, but in his freedom, he has created 34 czar positions, and that doesn't include Salazar, who's the Secretary of Interior. He's also a czar. There's too many, they're doing too much, and it's not answerable to anybody in America. Yes, ma'am.
My name is Barbara Meininger. I live here in Derby. I appreciate this chart, and I appreciate the fact that you've read the entire bill. I'm looking at the chart, though, and I think I went to school quite a few years, and even looking at this chart, I don't know what the NPDD, HPDS, AHRQ, CMS, etc., even is on this chart.
Yeah.
So my thinking is this is the summary of what's going to happen to us, that we're in big trouble. This is the summary. We've worked our whole lives. Everybody in here, I suspect, has worked their entire lives, taking care of themselves, helped their neighbors, done everything they need to do. We're a fiercely independent people. We can take care of ourselves. My dad finished the 8th grade, went to the military. All of us kids went to school. We can do what we need to do. We don't have to have the government tell us the heat for our house. We don't have to have you pick my doctor. My brother is a doctor. 1/3 of his patients don't even pay him, and he doesn't even go after them. So people can get health care that need health care, and you may have to wait in line to get it for free, but that's the price you pay. And I'm for helping anyone who needs help. If you are disabled or you need help finding a job, any of the things that are normal to help yourself, I'm behind it 100%, and I'm willing to contribute my fair part. In terms of what's actually in the bill, it's my understanding from what I have read and heard that government has access to our financial data as well as our medical data. The medical data, there's talk about this wonderful internet system of medical care is not that great. It's a drop-down system where when you go to your doctor, he's going to check off. Cheeks were flushed, had a fever, sent them home. Because that's all it is. And when it's sent to somebody else, that's all they're going to know about you. You're not going to have that one-on-one. It's going to take, according to my brother, 1/3 more time to be able to do that than to do what we're doing today where we have individual care. I also would like to know who wrote the bill. I know that Congress didn't write it. Who are the people that wrote it, and who are the people behind them?
The bill is actually written in 3 committees in the House, and it's largely done by the lawyers that they employ. It's called Legislative Counsel and staff on the committees like Commerce, Ways and Means, and Judiciary. So it has some, I can point to the people that write it, but the philosophy comes from a different area. It comes from outside, I think, elected officials. This philosophy was brought in by the administration.
So somebody just had an idea and they turned it over to people that we did not elect. Is that correct?
Basically. But keep in mind that you want to have, when the law is written, you want it to be at least something that makes sense, although there are parts in this that I think you could argue don't make sense. And you pointed out the financial records. What this bill includes is that every person included in this program will have to give access to their entire financial data to the government. So what your investments are, what your equity in your house, I mean, it's pretty thorough. Plus, in addition to that, that's page 58, by the way, page 59, it says that you get access to their checking account so they can directly take money out of your account. You're right about Americans being fiercely independent. I don't want that. I do not want that, and I don't know if anybody in this room wants to give up that kind of information to our federal government. It's bad enough that the IRS knows what they know, let alone the intricacies of our financial data. Thank you for the question. One more.
Hi, thank you very much for being here. Thank you all for being here. My name is Todd, and I've been in healthcare since 1974. Worked in one of the first freestanding surgery centers in this nation, in Wichita.